So last but absolutely not least, we have Dr. Tator. Cause of concussion and persisting symptoms determine recovery and type, duration, and number of symptoms. Would you like me to read your bio, Charles?
Thank you very much, Dr. Green. You can see from the number of authors on this paper how much work went into this analysis and how long it took us. This study is probably about 6 years in the making, and I'm going to go very quickly because it's late, and I might just point out that all of these patients that we examined and ended up with 600 patients who have concussion plus persisting concussion symptoms. So these are the people who didn't recover within 1 month and had, according to the definition that we use for this paper, they had at least 3 symptoms. So no recovery for at least 1 month, 3 symptoms, and we ruled out other intracranial lesions that they may have had, which are listed here, and some other exclusions from the total of over 900. And the years that we examined were 2000 to 2018. And the question that we wanted to answer was, is there an effect of the cause of concussion? Is a concussion a concussion, or does it matter how you get that concussion in terms of how long it lasts, your likelihood of recovery, and any of the symptoms that might be specific to that cause of concussion? So we divided the 600 cases into 4 broad category groups. Sports and recreation with the largest number, motor vehicle crashes, falls, and being struck by an object, including violence and other assaults, intimate partner violence. And we examined recovery from concussion in a specific fashion that was created for this particular study. So we had 3 types of recovery: those who recovered complete, those who were incomplete, and those where we had lost them to follow up, either because of compliance on the part of the patient, or moved away, or didn't answer any questionnaires. And we based recovery data on both clinical visits and on questionnaires that were sent periodically. And this shows the demographic features of those patients within the 4 causes. And you can see that there were major differences among the 4 groups. So that's sort of finding number 1, but there are several p-values here, that indicate can we go back? Sorry, back. Yeah, several p-values that are positive in terms of differences among the 4 broad categories. And one that I would like to point out in particular is the difference in age. The sports and recreation group were about half the age of the motor vehicle crash group, and several other differences including, for example, extracranial injuries, like what other injuries were present, like whiplash, etc. I think I'm going to go very quickly, and you can see that there were only a small number of patients who actually did recover completely. So the number of complete recoveries was very small, and I'll show you that in a moment again. There were major differences in the total number of symptoms. For example, the top row, that in the sports and recreation group, there was an average of 8 symptoms, whereas in the motor vehicle crash, there were 11 symptoms per patient. So significant differences in terms of what the cause of the concussion was. And these Kaplan-Meier curves show the difference in recovery for those patients. And the blue line shows the fastest recovery, which occurred in the sports and recreation group, and the motor vehicle crash group showed the slowest recovery. And in terms of which ages recovered more quickly, and it was the younger people who recovered fastest, and the older people recovered the slowest, and more older people had no recovery or incomplete recovery. And this shows again the difference between sports and recreation in blue and all the other groups in red, and how the Kaplan-Meier recovery curves show major differences according to the cause of concussion. This multivariate analysis was also done to show the difference between sports and recreation and the other 3 groups. So the message is that cause of concussion does matter in terms of what the symptomatology is, whether you're going to recover completely. And it looks like motor vehicle crash people are especially at risk. This just summarizes those results quickly. I know we're a little bit over, so I will go fast. I think most of the findings I've already indicated. I did mention that we created a new system to assess recovery. We had to do that because of the number of people who were, in fact, lost to follow-up for one reason or another. But patient compliance was a major factor. You send the questionnaires, if you send them to 100, you may get back 20 if you're lucky. In this population, it's a very mobile population. They don't like to answer questionnaires. So we did find a number of interesting relationships between the cause and the results of concussion. And the overall, another overall important finding was the slowness of recovery from concussion plus persisting concussion symptoms. In the literature, it's not well examined because of the paucity of follow-up studies of this length. We followed these patients for 10 to 15 years in some cases to see if they did ultimately recover. Those that were going to get a complete recovery did so within about the first 5 years or so. If you haven't recovered after about 60 months, according to this data, you're not going to make a complete recovery. But some recovery can continue for many years, but even though it's not a complete recovery. And I think we will conclude that. So thank you very much for your attention. I don't think we need any questions. We're all questioned out. So I'm going to go right into thanking people for attending. So what a hearty group that you stayed right to the end. And I think it's been one of our best symposium on concussion research, and a number of people to thank. Our two chairs for the sessions, Carmela Tartaglia, Robin Green. Thank you very much for that. And Mojgan Kotadati, our clinical research program manager. Got it right. Thank you, Mojgan. And is Kim Hussey around or in the next room? So thank you, Kim and Christian. We really appreciate your help again. So we hope to see you again next year. Thank you for coming.